Good afternoon, everyone. Today we will see the overview of toxicology. Myself, Dr. Avinash Waghmode. I am professor and head in Department of Forensic Medicine and Toxicology at BKL Balavalkar Rural Medical College, Chipron, Ratnagiri. First question: one of the following poison is excreted into the stomach? The options are arsenic, mercury, opium, lead. The answer for this question it is opium. Morphine is excreted in the stomach. There are some other poisons also which are excreted into the stomach even if they are administered by parental route. They are amphetamine, barbiturates, cocaine, and nicotine. Next question. All of the following are components of universal antidote except the options are activated charcoal, tannic acid, magnesium oxide, and potassium permanganate. The answer for this question it is potassium permanganate. For remembering the components of the universal antidote, you can remember this mnemonic that is ATM. It stands for activated charcoal 2 parts, tannic acid 1 part, and magnesium oxide 1 part. These are the components of the universal antidote. Hemodialysis gives best results in options are organophosphate poisoning, datura poisoning, barbiturate poisoning, and none of the above. The answer is barbiturate poisoning. Barbiturate poisoning. There are some indications for performing this hemodialysis. The most common indications are enumerated here. You can remember the mnemonic BLAST for the important indications of hemodialysis. The first one, it is the barbiturate, lithium, alcohol, aspirin, then beta blocker that is sotalol and theophylline. Now the next question is gastric lavage is contraindicated in which of the following poisoning? Options are organophosphorus poisoning, organochlorine poisoning, datura poisoning and sulfuric acid poisoning. Now answer for this question it is the sulfuric acid poisoning. Now you have to remember the absolute contraindications and relative contraindications for the gastric lavage. The only absolute contraindication to gastric lavage is corrosive poisoning because of danger of perforation. But it can be performed in case of carbolic acid poisoning as the mucosa becomes leathery instead of thinning out. This is the absolute contraindication for the gastric lavage. Now, what are the relative contraindications? So, in the following condition, the gastric lavage can be used, but by taking some precautionary measures. These include convulsant poisons, comatose patients due to risk of aspiration, volatile poisons, the patients having gastrointestinal diseases like esophageal varices, and some hypothermic conditions and hemorrhagic manifestations. Now the next question is poison which resists putrefaction is. The options are barbiturate, OP poisoning, lead, and mercury. Can you guess the answer? The answer for this question it is OP poisoning. Tetany is caused by which of the following poisoning? The options are nitric acid poisoning, carbolic acid poisoning, oxalic acid poisoning, and bromine poisoning. Can you guess the answer? The answer for this question, it is the oxalic acid poisoning. And this oxalic acid poisoning, it is associated with the Trouser's sign is seen in which of the following poisoning? Options are nitric acid poisoning, carbolic acid poisoning, oxalic acid poisoning, and bromine poisoning. The answer is oxalic acid poisoning. You have to remember this, that is hypocalcemia. So there are two signs, Trouser's signs. The Trouser's sign is nothing but the carpopedal spasm that is induced by ischemia secondary to inflation of sphygmomanometer cuff. And the second sign, that is Chopstick sign, which is nothing but the twitching of the facial muscles on tapping over the region of the muscles which are supplied by the facial nerve. Hydroquinone and pyrocatechol are derivatives of, the options are oxalic acid poisoning, carbolic acid poisoning, paraquat poisoning, and catecholamine. The answer for this question, it is carbolic acid poisoning. Onchronosis is associated with which of the following poisoning? Options are sulfuric acid, carbolic acid, oxalic acid, and caustic potash. So this answer for this question, it is the carbolic acid. Now xanthoprotic reaction is seen in, the options are oxalic acid poisoning, nitric acid poisoning, carbolic acid poisoning, and hydrochloric acid poisoning. The answer for this question, it is the nitric acid poisoning. Now what is this xanthoprotic reaction? On coming in contact with the skin or mucosa, there is yellowish discoloration of the skin or mucosa, and it is called as xanthoprotic reaction, and it is due to the formation of the picric acid. You have to remember this one, the xanthoprotic reaction, it is nothing but the yellowish discoloration of the skin or mucosa due to formation of picric acid, and which is seen in case of nitric acid poisoning. Ferric chloride test is used for diagnosis of sulfuric acid, carbolic acid, oxalic acid, and caustic potash. The answer for this question, it is the carbolic acid poisoning. Which of the following is used as a ink remover? Options are oil of vitriol, aqua fortis, oxalic acid, and carbolic acid. The answer for this question, it is the oxalic acid, which is used for removing the ink, that is the agent of forgery. Coffee ground appearance of vomitus is seen in, the options are nitric acid poisoning, oxalic acid poisoning, carbolic acid poisoning, and sulfuric acid poisoning. The answer is oxalic acid poisoning. Absolute contraindication for the gastric lavage is, options are kerosene poisoning, comatose patient, sulfuric acid poisoning, and all of the above. Here in such type of questions, you have to read the questions very carefully, because in the question the absolute contraindication for the gastric lavage is asked, and that's why the answer for this question, it is the sulfuric acid ingestion. All the remaining two, they are the relative contraindications for this gastric lavage. The answer is sulfuric acid ingestion. Antidote for the oxalic acid poisoning, it is the repeat one, that is the calcium gluconate. Fatty liver is seen characteristically in which of the following poisoning? The options are opium poisoning, cocaine poisoning, phosphorus poisoning, and morphine poisoning. The answer for this question, it is the phosphorus poisoning, because this phosphorus poisoning, it is associated with the acute fatty change in the liver, which is the very characteristic finding of this phosphorus poisoning. Chronic osteomyelitis of the lower jaw is associated with options are opium poisoning, cocaine poisoning, phosphorus poisoning, and morphine poisoning. The answer is phosphorus poisoning. Now, this chronic osteomyelitis of the lower jaw, it is also known as phossy jaw, and it is associated with the phosphorus poisoning, and which is characterized by toothache, swelling of the lower jaw, loosening of the teeth. You will get evidence of the necrosis of the gums that will lead to the chronic osteomyelitis, and that is seen in case of this chronic phosphorus poisoning. Copper sulfate, it is used as an antidote in which of the following poisoning? Options are mercury, cadmium, thallium, and phosphorus. So it is a phosphorus poisoning in which this copper sulfate, it is used as an antidote. So in these lower doses, this copper sulfate, it is acting as a poison, and in higher doses it is acting as an emetic. Luminescent omitus and feces are diagnostic of. The options are copper poisoning, barium poisoning, phosphorus poisoning, and lead poisoning. The answer is phosphorus poisoning. Breath and excreta have garlicky odor in phosphorus poisoning, OP poisoning, copper poisoning, and cyanide poisoning. Answer for this question. Now this glass blower's shake is associated with options are lead, mercury, arsenic, and thallium. The answer is mercury poisoning. This chronic mercury poisoning, it is also known as hydrargyrism, and this Hatter's shakes, it is also known as glass blower shakes, and these are nothing but the fine tremors of tongue, hands, which later on involves the legs. It is also known as Danbury tremors. Then there is one another manifestations of this mercury poisoning, that is mercurial erythism, which is nothing but some neuropsychiatric manifestations that are present in the form of shyness, timidity, irritability, loss of confidence, mental depression, loss of memory, insomnia, and it is termed as Mad Hatter syndrome. Mercurialintis. What is this mercurialintis? It is nothing but the brownish deposits of the mercury on the anterior lens capsule. On slit lamp examination, it demonstrates the malt brown reflex. And the most important feature of this mercurialintis is that it does not affect the visual acuity. So in case of this mercurialintis, the visual acuity remains normal. There is one another manifestation that is known as acrodynia or pink disease or swift disease. It occurs due to idiosyncratic hypersensitivity reactions to the vapors of the mercurous chloride. It affects most commonly the children, wherein the hand and feet becomes pink, painful, puffy, and parasitic. So you can remember these various P's that are associated with this acrodynia, that is pink disease, pink, painful, puffy, and parasitic hands and feet. Then Minamata disease, it occurs due to chronic exposure to the organic methyl mercury. Concussio mercurialis, it is the most advanced stage of this mercury poisoning. A middle-aged man visits to a clinic with a raindrop pigmentation and hyperkeratosis of the palms and sole, paresthesia of the hands and feet. The most likely poisoning is, the options are lead, mercury, arsenic, and thallium? The answer is arsenic poisoning. The poison which can be detected in hairs, nails, and burnt bones, and even in ashes. Options are lead, mercury, arsenic, and thallium. The answer is arsenic poisoning. The arsenic poisoning which can be detected in the hairs, nails, burnt bones, and even ashes is chronic arsenic poisoning. It is characterized by metallic taste, excessive salivation, garlic odor. The rash of this chronic arsenic poisoning that resembles the rash of measles. It is associated with the subendocardial hemorrhages, which are also known as Sheehan's hemorrhages. This chronic arsenic poisoning, it is associated with the sensory motor type of neuropathy. You have to remember here, this chronic arsenic poisoning, it is associated with the mixed type of neuropathy, that is sensory motor neuropathy. Raindrop pigmentation, then hyperkeratosis of the palms and sole. You have to remember these Aldrich-Mees lines. These are nothing but the irregular thickening of the nails and white bands of opacity in the nails of the fingers and toes. These are the Aldrich-Mees lines. Erethism is associated with options are lead, mercury, arsenic, and thallium. Answer for this question, it is the mercury poisoning. It is the mercurial erethism, which is also known as Mad Hatter syndrome. Clinical features of acute arsenic poisoning mimics with options are cholera, tuberculosis, typhoid, and tetanus. The answer for this question, it is the cholera. This acute arsenic poisoning resembles the acute cholera or acute gastrointestinal upset. All of the following samples are sent for laboratory examination in case of chronic arsenic poisoning except options are blood, nail clippings, bone, and hair. Can you guess the answer? The answer for this question is blood investigations, which are most preferable for acute arsenic poisoning. All the remaining options that are nail clippings, bones, and hair, they are performed for the chronic arsenic poisoning. Acrodynia is associated with options are lead, mercury, arsenic, and thallium. We have seen in the previous questions also. This acrodynia, it is nothing but the pink disease that is associated with the mercury poisoning. It is also known as Swift disease. Aldrich-Mees lines are seen in which poisoning? Options are lead, mercury, arsenic, and thallium. Answer for this question, it is the arsenic poisoning. Marsh test is used for detection of lead poisoning, arsenic poisoning, mercury poisoning, and copper. What is the answer? The answer for this question, it is the arsenic poisoning. You have to remember these names of at least the names of three tests because it is very frequently asked question in the entrance examination. You have to remember these three tests, that is Marsh test, range test, and Gutzit test, that are used for detection of this arsenic poisoning. Pink disease is associated with options are lead, mercury, arsenic, and thallium. It is also the repeated question. That is, answer is mercury poisoning. This pink disease, it is associated with the mercury poisoning. This pink disease, it occurs due to idiosyncratic hypersensitivity to vapors of mercurous chloride, and generally it affects the children most commonly. Wherein these hands and feet, it becomes pink, painful, puffy, and paresthetic. It is also known as acrodynia or Swift disease. Red velvety mucosa of the stomach is seen in which of the following poisoning? Sulfuric acid, mercury, arsenic, and nitric acid. What is the answer? The answer for this question, it is the arsenic poisoning. You have to remember some appearance of the mucosa in different poisoning. So this arsenic poisoning, it is having the red velvety mucosa. Sometimes it is also called as flea-bitten appearance of the mucosa of the stomach. Then blotting paper appearance is seen in case of sulfuric acid poisoning, and leathery appearance of the mucosa in case of carbolic acid poisoning. A patient presents with encephalopathy, wrist drop, colic, constipation. The blood picture shows basophilic stippling of RBCs. Most likely cause is, the options are chronic lead poisoning, chronic mercury poisoning, chronic arsenic poisoning, and chronic thallium poisoning. Can you guess the answer? All the clinical features that is mentioned in the question, they are the characteristic feature of this lead poisoning. The answer for this question, it is the chronic lead poisoning. Chronic lead poisoning. So you can remember this mnemonic, that is ABCDEF for this chronic lead poisoning, that is anemia, which is a type of microcytic hypochromic anemia, and it is due to inhibition of this heme synthesis. And B for Burtonian line, and this basophilic stippling. The one thing here you have to remember, that there is no relation of this basophilic stippling with the basophils, because this basophilic stippling, it is because of the basophilic dyes. Next is constipation. D is drops, that is wrist drop and foot drops, and not diarrhea. So you have to remember that this lead poisoning, it is associated with the constipation and no diarrhea. Then encephalopathy and facial pallor. And this facial pallor, it is the earliest manifestation of chronic lead poisoning. All of the following are features of acute arsenic poisoning except red velvety stomach mucosa, raindrop pigmentation, acute tubular necrosis, and omitting acute throat pain. This raindrop pigmentation, it is a manifestation of the chronic arsenic poisoning, or the all the remaining options, they are the features of acute arsenic poisoning. Flea-bitten appearance of the mucosa of the stomach is seen in which of the poisoning? Again, the question is repeated. The answer is arsenic poisoning. A female patient presented with anemia with basophilic stippling on peripheral smear. The blood pressure 160 to 120 mm of Hg, and there is history of repeated abortion. The most probable diagnosis is chronic arsenic poisoning, chronic mercury poisoning, ergot poisoning, and plumbism. The answer for this question, it is also very clear cut. That is plumbism. That is chronic lead poisoning. Plumbism, or it is also known as Saturnism. Malt brown reflex from the anterior lens capsule can be elicited in the poisoning by. The options are arsenic, mercury, methyl alcohol, LSD. We have seen in the previous question also, this mercury, it is associated with this malt brown reflex because of the brownish deposits on the anterior lens capsule. Which of the following is not a feature of chronic arsenic poisoning? The options are anemia, mesothelioma, hyperkeratosis of the palms and soles, and sensorimeter neuropathy. The answer is mesothelioma, because this arsenic poisoning, it is not associated with the mesothelioma. Subendocardial hemorrhages in the left ventricle are seen in case of poisoning by. Options are sulfuric acid, carbolic acid, cannabis, and arsenic poisoning. The answer for this question, it is the arsenic compounds, because we have seen in the previous question also, the subendocardial hemorrhages, they are also known as Sheehan's hemorrhages and which are seen in the left ventricle in cases of poisoning due to the arsenic compounds. Black foot disease is caused by, the options are lead, mercury, arsenic and thallium. The answer for this question, it is the arsenic poisoning. What is this black foot disease? This arsenic, it causes thrombosis of the peripheral arterial system that leads to gangrene of the extremities, and hence it is termed as black foot disease. Chills resembling an acute attack of malaria are seen in poisoning with. Options are arsenic poisoning, lead poisoning, copper poisoning and zinc. What is the answer? The answer is zinc poisoning, that is associated with the acute attack-like features of malaria. McEwan's sign is seen in poisoning with barbiturate poisoning, cyanide poisoning, ethyl alcohol poisoning and all of the above. The answer for this question, it is the ethyl alcohol poisoning. Now what is this McEwan's sign? In the stage of coma of alcoholic intoxication, his pupils are contracted, but on stimulation of the person by pinching or slapping causes them to dilate. And this sign is positive above the blood alcohol concentration 300 milligram percentage, and this sign will differentiate between this alcoholic intoxication and head injury. The best antidote for methyl alcohol poisoning is, the options are alkaline diuresis, then ethyl alcohol, then intravenous fructose and citrated calcium diuretics. The answer for this question, it is the ethyl alcohol. It is the ethyl alcohol. Widmark's formula is used for detection of. Options are cyanide, alcohol, OP poisoning and organochlorine poisoning. What is the answer? The answer for this question is the alcohol poisoning. So this Widmark formula, it is used for detection of the concentration of the alcohol in the blood. There are separate formula for the concentration of the alcohol in the blood and the urine. So for the blood, it is A is equal to PRC, and for urine, it is A is equal to 3 by 4 PRQ, wherein this A, it is the weight of the alcohol, then P is the body weight, R is the constant, C is the concentration of the alcohol, and Q is the concentration of the alcohol. Korsakoff psychosis is seen in. Options are chronic renal failure, chronic alcoholism, chloral hydrate, and cocaine. What is the answer? This Korsakoff psychosis, it is associated with the chronic alcoholism. Korsakoff psychosis is characterized by all of the following except peripheral neuritis, muscular hypertrophy, retrograde amnesia, and cortical degeneration. The answer for this question, it is the muscular hypertrophy, because this Korsakoff psychosis, it is associated with the muscular atrophy. We have to remember these features. This by the mnemonic GOA, that is G for global confusion, then O for ophthalmoplegia, and A for ataxia. Next question is, optic nerve atrophy is an important feature in poisoning by. Options are barbiturates, strychnine, methanol, and ethanol. What will be the answer? The answer is methanol poisoning, and it is the characteristic feature of this methanol poisoning, that is optic nerve atrophy. Which of the following is not an aryl phosphate? The answer for this question, it is the malathion. All the remaining, that is parathion, diazinon, and pholidol, they are the aryl phosphates. The answer is malathion, which is the alkyl phosphate. So you have to remember this alkyl phosphates and aryl phosphate. In the alkyl phosphates there is dimethox, malathion, TEPP that is tetraethyl pyrophosphate, then HETP that is hexaethyl tetraphosphate, octaethyl pyrophosphoramide that is OMPA. This aryl phosphates it includes parathion, methylparathion, peroxone, then chlorothione and diazinon that is TIC20. So sometimes you have to remember these trade names also, that is Folidol, TIC20, because many a times this question is asked for these trade names also. Gastric lavage was done in patients of poisoning. When gastric lavage comes in contact with the silver nitrate solution, it turns black in color. The most probable diagnosis is, the options are aluminum phosphide, organophosphorus poisoning, barbiturate poisoning, and organochlorine poisoning. What is the answer? Answer for this question, it is the aluminum phosphide. And this silver nitrate solution test or silver nitrate test, it is used for detection of this aluminum phosphide, wherein that paper becomes black due to formation of the phosphine. The next question is, patient comes with pinpoint pupil, salivation, tremors and red tears. Cholinesterase activity was 30% of the normal. The probable diagnosis is, the options are opium poisoning, datura poisoning, organochlorine poisoning and organophosphorus poisoning. What will be the answer? The clinical features are pinpoint pupils. It is associated with the tears, and cholinesterase activity was given at 30% of the normal. The answer for this question, it is the organophosphorus poisoning. So you can remember this acronym for this organophosphorus poisoning, that is sludge: salivation, lacrimation, urination, defecation, gastrointestinal cramping or upset, and emesis. Poisons interfering with the nerve impulse transmission include DDT, malathion, diazinon, and parathion. By looking at these options, the only option that is associated with this nerve impulse transmission, that is DDT, which is a type of organochlorine compound poisoning. All the remaining options, they are the organophosphates, which are the cholinesterase inhibitors. Which type of poisoning is associated with the chromodacryuria? Options are arsenic, lead, organophosphorus, and barbiturates. What is the answer? The answer for this question is the organophosphorus poisoning. So this chromodacryuria, it is nothing but the red tears that is associated with the organophosphorus poisoning. Treatment of carbamide poisoning consists of all except, options are atropine, cholestyramine, pralidoxime, and oxygen inhalation. The answer for this question is the cholestyramine. Now, what is the difference between these carbamates and organophosphorus poisoning? It causes inhibition of this acetylcholinesterase enzyme, but it is the reversible inhibitions. It is a reversible inhibitions, and that's why the clinical features of this carbamate poisoning, they are less severe type as compared to the organophosphorus poisoning. And it is, as it is reversible, it is hydrolyzed spontaneously from the binding site. Signs and symptoms resembling thyrotoxicosis are caused by, options are organophosphates, organochlorine, dinitrophenol, and aluminum phosphide. What will be the answer? The answer for this question, it is the dinitrophenol. Dinitrophenol, it is associated with the thyrotoxicosis. Thank you.